Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. On the last video, I was drilling down a little bit on carbohydrates. There's clearly, in some of my patients, a misunderstanding about what a carbohydrate really is. And so I talked about every single form of refined grain. I don't care if it's whole wheat or not. I don't care what the advertiser says about it. I don't care if it says whole wheat, whole grain, whatever. It's all carbohydrate, and it's all going to get you in trouble. All right? All the starches, I don't care if it's a sweet potato or brown rice versus white potato, white rice. When you're trying to lose weight, these things can impede your weight loss, okay? So I ended the video by saying we're going to talk about sweets, all right, on this video, because there's also a disconnection here. People say, well, I'm not eating carbs, okay? So what are you eating? Well, I've cut out the rice, I've cut out the potatoes, I've cut out the cereal. Okay, good. So what are you eating? Well, where I make a mistake, they'll say, is I have some candy, say, in the evening or as a dessert or in the afternoon or whatever. And when I drill down on that, it's clear that people think that sweets are something other than carbohydrate. Okay? Look, sugar is just the worst form of carbohydrate. Think of it that way. All right? Sugar is a carbohydrate. Every piece of cake you eat, every piece of candy you eat, if you drink sugary soda or sugary tea, that's all rapidly absorbing carbohydrate. Okay? The sugar is a rapidly absorbed carbohydrate. It jacks up your glucose. You have to make a ton of insulin. I've talked before about how sugar is toxic and addictive, so you know that if you watch these videos. But look, sweets are carbohydrates, okay? And they are not good for you. And I guarantee you that in a large number of patients that I see, it is the thing that people do that keep them from losing weight. And all it takes is once a day, a small amount in many people, to actually stop their weight loss or even make them gain weight. So to summarize the last two videos, all form of refined grain. I do not care if it's whole wheat. I don't care if it's whole grain. Every form of bread, cracker, cereal, anything that's in a bag or a box on those middle aisles of the grocery store, it's carbohydrate, okay? All forms of starch, not just white rice and white potatoes. Brown rice, sweet potatoes, quinoa, all that. It's all carbohydrate. That stuff breaks down to sugar. Sugar goes up, you make insulin, it's trouble. And then look, all forms of sugar, whether it's fruit or whether it's a Snickers bar, okay, it doesn't matter. All sweet soda, sweet tea, pancake syrup, you name it, it's all bad carbohydrate. Okay, and these are the things that I want you to get out of your diet. They produce disease in many people, and they make you overweight, and they keep you from losing weight. So on the next video, I'm just going to explain maybe an exception in my mind to this carbohydrate rule, and we'll talk about that on the next video. But until we do, I'll give you the tools, you give me the effort, and together we overcome obesity.